Hi everybody, this is Fred Eckert with Chicago Title. I want to take the time to pass along something of an important but personal note. Please pass this along to as many women in your life as you can. My wife passed away July of last year after a reoccurrence of breast cancer. We had initially gone through the chemo and radiation and stopped that September a year ago. Now that's like a year and a half from now. And the following April, she started complaining about, end of April, started complaining about her side hurting. Now, a lot of the doctors that we talked to attributed that to a complication from radiation, so it was not uncommon for 6 to 9 months after radiation to experience the kind of pain she was feeling. Well, apparently what really was occurring was the cancer had come back. It was going into her bone marrow, the best that I can tell right now. This was done after the fact that we noticed this. She started complaining about having trouble breathing and so forth. But the sequence is what's important, I think. We didn't know, because you look at mammograms, you look at ultrasounds and so forth, that anything was, in her bloodstream. But this bone marrow cancer, you have to test it, as far as I know completely, you have to test it by a very expansive and complicated blood test. We found that out after the fact. In fact, about 4 days before she passed away, we found that out, and the doctors had then tried to use some Zometa, Z-O-M-E-D-A, which is a drug to help prevent this calcium leaching out. Because calcium, when it leaches out of your bloodstream, it attacks your organs. It's very, very, very toxic. In fact, her death certificate indicated hypercalcemia, cardiac arrest, and metastasized breast cancer as the 3 causes. And the hypercalcemia attributed to the heart attack, because it's very, as I said, very toxic to your system, lungs, organs, and so forth. So what I would encourage you to do is let your loved ones know if they're been diagnosed with cancer, if they have questions about this. Ask their oncologist about Zometa and whether that might be applicable in their case. Again, if you didn't have the blood test, you might not necessarily know that the cancer could possibly be in your bone marrow. In my wife's case, it was. It doesn't happen to everybody, but it can happen. So I encourage you to have your loved ones ask about that of their oncologist. And because it's a fairly expensive test, in fact, we were going to try to do a clinical trial. That's how we found out about it. I don't know that we would have even known that until she had passed away. And once we did try the Zometa, when they tried to give that to her in an IV, it was kind of too late, because that was only 4 days before she passed away. And I'm convinced that she had this bone marrow cancer months before it was diagnosed. So I hope you take that to heart and let your loved ones know. Again, pass this along to as many people as you can. And it never hurts to ask, at least if they're facing that kind of an issue. Ask the doctor about something called Zometa and possibly whether there could be any complication for something with their bone marrow. I hope this helps, and if you have questions, please don't hesitate to call me. I'd be happy to talk to anybody about this and what I learned from this with my wife's passing. 619-507-5688. Thank you.